Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. We had been daily studying together. Finally, that day has come. On March 5th, when the NEET PG result came, we were thinking, oh my God, we were very far away. Just my last attempt. I can't fight anymore, kind of a feeling. From March 5th, April 5th, April 5th to May 5th, time passes without waiting for anyone. So finally, the D-Day where you need to take the gun and fight has come. You did very well. Almost every day we are meeting and doing revision and so many videos, so many high-yield topic lists, so many question bank, PYQ discussions, everything we had. So go to the exam strongly, carry two things. C for common sense, C for confidence. And you will see that you are in the top rank of the INICET automatically. So as a farewell session, let us take up once more. PYQs always are the gold standard, doctor. Can you please punch? Is the voice loud and clear for all of you, doctor? Can you please punch? So PYQs had always been the gold standard anytime you go to the exam. So we will take up some of them. Can you please punch? Is the voice loud and clear for all of you? I'm broadcasting from the home. So, doctor. Thank you, Dr. Surendra. So, respiratory quotient. What is the value for carbohydrate meal? 1. So, for fatty acid, it is 0.7. For protein, it is 0.9. During exercise, the most rapid way to synthesize the ATP, obviously, it is the phosphocreatine, which is common in both humans and lower animals. In all of us, we have phosphocreatine, which is an abundant source of supply of energy. Once more, doctor, tomorrow INICET May 2023 also. One question is going to come on Vmax, Km, competitive, non-competitive, uncompetitive, all the three types. Vmax decreases. So you need to remember about each of the types. Malonate is the competitive inhibitor of succinate dehydrogenase. And in the presence of a competitive inhibitor, Vmax is unchanged, but Km, that is the substrate concentration at which half maximum velocity is achieved for an enzyme, that half maximum velocity to achieve, you require higher amount of substrate concentration whenever there is a competitive inhibitor, is what you need to remember. Then what is non-competitive inhibition? So there are certain divalent metal cations and chelating agents like EDTA. So EDTA like chelating agents will cause the enzymes that require divalent metal cations inhibited by non-competitive inhibition, is what you need to remember. So the Vmax decreases, Km is unchanged in case of non-competitive inhibition. Third type is called uncompetitive inhibition. That also you should know. So intestinal alkaline phosphatase inhibited by L-phenylalanine. So whenever multi-substrate reactions are there, that is called uncompetitive inhibition. So in case of uncompetitive inhibition, typically what will happen? So in uncompetitive inhibition, The Vmax and Km. So you can see what is the effect of it, unlike in competitive and non-competitive inhibition. So competitive inhibitor, remember, one easy mnemonic, very popularly remembered is competitive inhibitor Km increases. Very efficient, Vmax efficacy. So competent Km is potency petent. Another stupid way to remember. So let me summarize for you for tomorrow's exam. In competitive inhibition, Km is increased, Vmax is unaffected. Uncompetitive inhibition, both Km, Vmax, both of them are reduced. Non-competitive inhibition, Km is unaffected, but Vmax is reduced. So once more in tomorrow exam hall, one question comes on enzyme, types of inhibitors. You'll remember Murali Bharadwaj, right? So in cerebrohepatorenal syndrome, what will accumulate in the brain, doctor? Very long chain fatty acid. Very long chain fatty acid is the one which get accumulated is what you need to remember. One minute, doctor. There are some comrades who need to be reminded that the live class has started. They will join the session. Our regular comrades. Yes. So I hope the voice is loud and clear for all of you for my reassurance. So it is a very long chain fatty acid. So peroxisomal disorders are called Zellweger syndrome, cerebrohepatorenal syndrome. This is autosomal recessive disorder, dysmorphic facies, very long chain fatty acids. This is how typically the cerebrohepatorenal syndrome of Zellweger, the peroxisomal disorder is what you need to remember. Type 1 diabetes complaints of polyuria, what will occur normally in his body? There is an increased conversion of fatty acid to acetyl CoA. Whenever insulin is not there, ketogenesis, everything is promoted to ketone body production. So what is the precursor of ketone body? Ketone body precursors are all acetyl CoA. So that is the reason acetyl CoA conversion will increase whenever insulin is deficient is what you need to remember. So this is one question sure shot to come in the tomorrow's NEET PG. Thank you, Vinisha, for participating in the discussion. So if you look at what is the function of insulin, please don't forget. Decrease glycogenolysis, decrease gluconeogenesis, decrease ketogenesis, increase glycogen synthesis and fatty acid synthesis. Insulin is a lipogenic hormone. In the adipose, it will decrease the lipolysis, increase the glycerol, increase the fatty acid, increase the glucose uptake. In the muscle, it decreases the protein catabolism. That is the reason diabetic individuals, there is an increased protein catabolism. And that is the reason diabetic amyotrophy, where there is degenerated muscles due to increased protein catabolism, will occur whenever there is diabetes and there is no insulin. There is an increased amino acid uptake, increased glucose uptake, increased protein synthesis and increased glycogen synthesis, decreased glycogenolysis. Please don't forget this very important combination, doctor. Yasmin Khan says, sir, why you delete these live videos? Because we want you to subscribe to the video library. For a small nominal fee. Doctor, we deleted. So please connect with 900868 and we will help you to get a subscription for a throwaway price. So, Northern blot. is for what? Northern blot is for RNA, southern blot, DNA, western blot, protein. All of you know very well. A child presents with coarse features, coarsening. So a child present, all these videos are made available, doctor, in the app. They are there, on the website they are there, on the score app.in, www. It is all available, all the videos, all the PowerPoints, everything available. So please join. But please come to the class. You know, this live interactive session is absolutely free. Whether you are a student or not, we love to meet you every day. Spend time, a couple of hours to study along with you. Frontal head enlargement, thickening of the cardiac wall, hepatosplenomegaly. What is the most probable diagnosis? Everything is Hurler. Hunter is X-linked. Hunter has no corneal opacity. Hurler has a corneal opacity. This is one favorite question of the examiner. One polysaccharidosis, doctor, definitely asked in the tomorrow's NEET pages. So this is how the coarsening of the features is a classical feature of Hurler. And corneal opacity is a feature of Hurler, is what you need to remember. So hepatosplenomegaly, coarse facial features, corneal clouding, large tongue, they're all the features. Very nice to see 20 online classmates. Thank you all for coming to this farewell session. Please inform your friends also. Doctor, NEET PG next, whatever naam, Allah Miya ho ya Bhagwan Krishna ho, Govind ho, Isai ho, kuch bhi ho, baat to ek hi hai. Question bank is more or less same. So starting from Monday up to December 31st, every day there is a 2-hour live session, doctor. There is at least 100 MCQs we will discuss. So how many months it is? June, July, August, September, October, November, December. 7 months. So plus this May, 8 months. Almost 220 days. We will discuss almost 20,000 question bank. Not only me, whenever I don't get time, a lot of other teachers also will come and discuss. Every day free on YouTube. So if you want the schedule of the NEET PG next free live class coaching, please call today only. 9000868356 is our number. And Rose Milenge, Rose Padenge, that is the most important thing that you need to practice, doctor. So, biomarker of alcoholic hepatitis kya hota hai? Gamma glutamyl transaminase. So you should know what is child pukes classification, etc., etc. So total serum bilirubin more than 3, ALT, AST elevated more than 1.5 times the upper limit of normal. AST by ALT ratio more than 1.5. These are the important components to call that it is alcoholic hepatitis is what you need to remember. So what is the method of transport of glucose into the intestine? Every INICET may, one favorite question they will ask, doctor. You need to be very sure. Primary active transport, simple diffusion, secondary active transport, everything you need to be sure. So it is the secondary active transport. So there is a SIMPORT system which transports sodium, ions and glucose together into the cell, which is called secondary active transport. What is the type of connective tissue which is being shown here? It is called dense irregular, not dense regular, dense irregular. So connective tissue helps to store fat. transporting the blood, just like in the blood, is a connective tissue. So there are many functions of connective tissue. So connective tissue is embryonic or mesenchyme. Adult, it can be loose, dense, cartilage, bone, blood, and connective tissue with special properties. So loose connective tissue का मतलब होता है areolar tissue. Most organs and tissues have it, and it attaches to the skin. It contains collagen, reticular, elastic fibers. Dense is abundant collagen fibers like tendons, ligaments. And dense irregular is scar. Dense irregular is most of the skin dermis. Dense irregular elastic is elastic arteries. So what you can see here, doctor, is typically fibroblast, collagen fibers, dense regular connective tissue. This is dense irregular connective tissue. So I leave the literature for you. Please do the revision, doctor. Now, correct pairing regarding lymph node and their anatomical boundaries. You need to be very sure. One question on the neck lymph nodes and their anatomical classification into various levels is a favorite question. Hyoid to clavicle is level 6. So level 1, level 2, level 3, level 4, level 5, and level 6 you need to be very sure about. So once more, this is purely batti marne wala item hai, फिर भी पढ़ना पड़ेगा. 1A is lower lip, mouth, anterior 1/3 of the tongue and anterior 1/3 of the mandibular alveolar ridge. 3 is mouth, nasopharynx, oropharynx, hypopharynx, larynx. They all are supplied. Thyroid gland, larynx, and cervical esophagus will go to the level 6 is what you have to remember. So what are the boundaries? Superior, inferior, anterior, posterior boundaries of each of these various levels of lymph nodes in the neck. Purely batti item. But because it has come in AIIMS November 2018, और एक बार INICET में वही क्वेश्चन आएगा. That is the power of the PYQs, previous year questions, doctor. So what is the marked area involved in relieving pain when a painful site is massaged? It is called substantia gelatinosa. So this is the area, substantia gelatinosa. So this is nucleus proprius, this is dorsal nucleus of Clark, this is intermediolateral nucleus, motor nucleus of the Anderhorn. So these are all the various things that you need to remember. So the apex of the posterior part of the gray column of the spinal cord cross section is capped by a V-shaped crescentic mass, which is called substantia gelatinosa of Rolando, is what you need to remember. So now, doctor, identify the structure. What is this nerve? So remember, every INICET may one skull foramen, one cranial nerve to be identified. One question sure shot in INICET, doctor. Tomorrow also you will get one and you will come back and remember me. All cranial nerves for that matter. So it is oculomotor nerve, which will be passing very close to the posterior communicating artery that connects the posterior cerebral artery with the internal carotid artery, is what you need to remember. So this image signifies which condition? So once more, the eye is unopposed abducted position. That itself speaks that it is oculomotor nerve palsy. In the primary position only it is abducted. So what is that you see normally in lumbar spine? We see lordosis. So lord के जैसे चल रहे तो lordosis. Kyphosis. This is forward head like in ankylosing spondylitis. This is the perfect posture of a soldier. So normal spine, lordosis of the spine, exaggerated lumbar curve. Purkinje cells, once more, every INICET exam, cerebellum histology, basket cells, Purkinje cells, all these things you need to be sure, doctor. So it connects with inferior olivary nucleus. So what is the purpose of inferior olivary nucleus? There are two nuclei, inferior olivary nucleus and superior olivary nucleus. Superior olivary nucleus is associated with auditory pathway. Clear? Son is auditory. Duryodhan is whose son? A son who doesn't listen the word of his dad. Son is auditory. Okay. So inferior olivary nucleus is associated with what? All your spinal cord sensory supply will reach lower part of medulla, and all that sensory information will pass to cerebellum. So all the sensory pathway will reach inferior olivary nucleus in medulla. From there it will go to the cerebellum. That is a function of inferior olivary nucleus is what you need to remember. So the inferior olivary inputs sensory information to the cerebellum, and the Purkinje cells communicate the output to the thalamus. From Purkinje cells are output. Input कहाँ से आएगा? Input मिलेगा inferior olivary nucleus, which brings all sensory information to the cerebellum, is what you have to remember. And how does that reach? Typically, there are three cerebellar peduncles. Inferior cerebellar peduncle, superior cerebellar peduncle. So inferior olivary nucleus bring all the sensory information from the spine. It will communicate through the inferior cerebellar peduncle and reach it to cerebellum. From the cerebellum, the Purkinje fibers pass the information through superior cerebellar peduncle, which will ultimately reach red nucleus near the midbrain, and from there it will go to thalamus. That's the reason this is called dentato, that is dentate nucleus, rubro, red nucleus, spino, dentato, rubro, thalamo, cortical pathway is what you need to remember. So what is the location of Meissner's corpuscles? Once more, Dr. Meissner's, Pacinian, they're all very important question. Papillary dermis is the location of Meissner's corpuscles. They detect the touch. Free nerve endings. Free nerve endings detect the pain. Right? Meissner's corpuscles detect the touch. So this is how histology of the Meissner's corpuscles. Once more, remember, tomorrow INICET also. One Meissner or Pacinian or roughness or free nerve endings. One question short आएगा कल के INICET में. So now, what is this marked layer that you typically see? Doctor, mark, what is this layer which is marked? It is the inner plexiform layer, is what you need to remember. So all the visual information is reported to photoreceptors from their horizontal cells, then bipolar cells. Until here you call outer plexiform layer. Then hemacrine cells, ganglion cells, they are all inner plexiform layer. Ultimately, they lead to what, doctor? Spikes. So please don't forget rods and cones, horizontal cells, bipolar cells, hemacrine cells, ganglion cells. What is it? Where is inner plexiform? Where is outer plexiform? One question will come on this entire vision, rods, cones, dark phase, light phase, layers of retina, everything. You need to be good, doctor, for the tomorrow's INICET. Golgi apparatus is serous acinar cells, where at supranuclear level. So the basal portion of the cytoplasm is filled with rough endoplasmic reticulum. They produce a lot of protein for secretion. The rough endoplasmic reticulum is well developed and arranged like parallel stacks. Then apical cytoplasm typically has Golgi apparatus is what you need to remember. So, doctor, patient with syphilis unable to walk with the closed eyes, stomping gait, he's hitting the floor and walking, stamping gait. So, name the tract involved. It is the dorsal column tract which brings position, vibration, and all that get affected in tabes dorsalis. Ligamentum flavum typically has elastin. So, elastin, collagen, compulsory. One question will come. So, reticulin is a type 3 collagen. Reticular fibers, they support the structures of various organs like liver and spleen is what you need to remember. Left superior intercostal vein, it drains into brachiocephalic vein is what you need to remember. So you should be quite sure about this important anatomy of thoracic duct and the venous drainage. So these are the vertebral veins, doctor. Left supreme intercostal vein drains first space directly into left brachiocephalic. Right supreme intercostal vein drains the first space into right brachiocephalic, occasionally directly into right vertebral vein. Second, third spaces into azygos, they arch into superior intercostal vein. Fourth, fifth, sixth, all spaces below this go directly into azygos. This is all on the typically right and left. Then second, third spaces to left superior intercostal vein that drains into left brachiocephalic vein. Fourth, fifth, sixth, and all spaces below that will go into hemiazygos and accessory hemiazygos is what you have to remember. So now, doctor, which nerve is not associated with olfaction? Right? 12th is not associated. 12th is not associated. So, doctor, that is a short review. So mainly my intention is to give you a farewell, to tell you what all the PYQs we discussed. The same things, ek martaba, revision karo. 1150 topics I gave you, doctor. So what you need to do, those 1150 topics, PDF. If you don't have, please directly ping me, WhatsApp me, I'll send you. Every subject made top 60 topics in descending order of priority. Top 30 topics पढ़ो. Each topic के ऊपर 20 points अपने मुट्ठी में रख के anticipate करके जाके examiner को attack करो. So that is the plan. I'll be eagerly waiting tomorrow to see how you performed, and some questions, 30-40 questions will be completely unreachable, unanswerable, impossible to answer. Don't regret about them. But 160 questions, you should expect attack, expect attack, expect attack. Topics like cervical cancer, ovarian cancer, carcinoma cervix, carcinoma endometrium, TB. Without a TB, there is no paper. Without contraception, no paper. Without national programs like Janani Suraksha Yojana, right? So anemia prevention, blindness prevention, all these SPM boring topics will be there. No, last moment you need to completely pack them. So that's how you need to go to the exam. Sleep early, wake up, pray God to give you the strength for what you are born for. You are born to be a winner. That's the reason 15 lakh people took the exam. You are among the 90,000 selected people of the God. Now from this 2.6 lakh aspirants, you should be in the top 5,000 ranks to join the post-graduation in government college. Good night and see you all tomorrow once more We will recollect the questions and then discuss the paper. Good night.